Each year, December 1st is observed internationally as World AIDS Day to raise awareness of the AIDS pandemic caused by the spread of the HIV infection, and also to acknowledge those impacted or affected by the disease. Here on Montserrat, we also join in that observance. So today I'll be speaking with Health Promotion Coordinator in the Ministry of Health, Mrs. Penny Maloney, to get a local perspective and data on Montserrat's current status. Penny, thank you for speaking with me today about this very important topic.
Yes, you're welcome. Happy to be here with you today.
Right, first, provide your thoughts on the significance of World AIDS Day, particularly as it relates to Montserrat.
It's very important. It's a day really to raise awareness, as you previously mentioned, but it's also a great day for reflection on what we've done so far, where we are, and this is specifically as it relates to our goal of eliminating HIV and AIDS by 2030. And this is not a local goal, this is a global initiative that we've all signed on to. By 2030, we want there to be no new infections. So World AIDS Day is a great opportunity to reflect on where we are in that goal and also to see what we need to do, what our challenges have been, how can we overcome these challenges so that that goal is more than a dream, it's a reality. So it's really a significant day for us.
Right, so you mentioned the elimination of HIV or AIDS altogether by 2030 as the global.
2030.
How is Montserrat doing in terms of getting to that point, though?
We're doing really well in terms of policies. For example, we have a test and treat policy where as long as you're HIV positive, you are treated regardless of gender, nationality, your status on island. You're entitled to free medical care. And that's treatment for HIV as well as other basic medical care. We're also doing really well in terms of our medications. Our medications are up to date with the current standards. We've never experienced stockouts of HIV medicine. It's always in stock. So we're doing great in terms of things like that. But of course, there's always a need for more awareness, pushing safe sex and condom use and also testing, because we can only eliminate if we know who is positive and we get them in treatment so they can't further spread the disease. So there's still more work to be done, but we're definitely on our way.
Right, good to hear. Is there a specific theme for this year's observance?
Yes, the theme for this year is communities make a difference. So it's really a grassroots theme. It's a theme that speaks to all of us, that says, okay, wherever you are, in whatever community, you have a responsibility to help us as we work towards this goal of elimination.
That's good to hear. And what about the activities? Is the ministry planning any activities around World AIDS Day this year?
Well, our activities, the first thing, we're going to be on the breakfast show with Basil. So you'll hear us on breakfast show speaking about World AIDS Day. It actually falls on a Sunday this year. So on December 2nd, on the Monday, we will be on air with Basil Chambers on the breakfast show. You'll hear lots of music. It's festival season and we have lots and lots of calypsos around HIV and AIDS. So we'll be there. We'll be chatting. It's also a great opportunity for persons to call in and give their thoughts and their own experiences about what's happening and maybe help tell us how we can get the message out some more. So it's a great morning for engagement. We'll be doing that. And then later in the day, I'll be out on the streets. We're going to be doing mass condom distribution on that day in preparation for the festival. Every year we work with the Arts Council to make sure that all the bars in Festival Village are stocked. So we'll be doing that as well as going to the bars on island. Some of them call me the condom lady, so when they see me come in, they know what it's about. So we'll be doing that grassroots initiative throughout the day. We'll also be launching our social media campaign, Choose Safe Sex, and it's a youth-centered campaign. The faces that you'll be seeing are faces of the youth. The messages are youth-centered messages, and it's not just a day campaign. I'm going to be continuing my work with the secondary school, going into the college as I usually do, to really push the message. And I focus on the youth a lot because I really believe that the youth are agents of change, the best agents of change. And if we want to end the spread of this disease by 2030, we have to really target them, make sure that they don't get infected. Yeah, so that's where my focus will be for World AIDS Day.
Right. I absolutely love the idea of using the youth and, of course, local faces in as part of the awareness activities, because, of course, they would connect better with the
Yes,
audience here.
exactly,
Right.
exactly.
Let us focus now on the disease itself. Tell me about AIDS, cause, treatment, and prevention.
Well, as you would have mentioned, I believe in your introduction, you would have said that AIDS is caused by the spread of HIV. And for those who don't know what those acronyms are, HIV is the human immunovirus, and AIDS is acquired immune deficiency syndrome. So that's what it stands for. So if you contract HIV, you contract it via sexual means. So sexually transmitted infection. You can also get it from mother to child, a mother spreading it in the womb to a baby, or through via childbirth. You can also get it from contact with infected blood. So way back when this disease was new, a lot of persons would have contracted HIV through blood transfusions, for example, drug users, sharing needles. Those are some of the means through which the virus is spread. Now, if the HIV virus remains untreated, it develops into AIDS. And when a person gets AIDS, that's basically the end of the situation. Treatment has changed so drastically throughout the years, and I know that we really have to say a big kudo and thanks to the scientists who really have been working quite hard throughout the years to make treatment what it is now. And I'll give you a little bit of a backstory. When I started out as a pharmacist in the early 2000s, when a HIV positive patient came to the pharmacy to get medication, we would literally have to find a box to give them all these bottles of tablets that they had to take throughout the month. But now we have treatment have evolved that it's literally just one pill a day, and that one pill a day causes viral load suppression. And if your viral load, now the drugs are so very effective that if your viral load is low enough, the virus becomes undetectable, and undetectable means that you can't transmit it to others. So basically, it's almost like being not positive. But once you stop taking that medication, of course, the virus would again begin to replicate. So one pill a day, and you can really live happy, productive life, fruitful life, free of complications. So treatment has really come very, very, very far.
Right. Now, in Montserrat, do we currently have anyone living with AIDS?
No, we do not. Our last death from AIDS was back in 1999, and that was an elderly person, over 60, a man who passed away in 1999. And since then, we have not had any deaths from AIDS, and we presently do not have any persons living with AIDS on island.
That's absolutely good news. Let's move on now to HIV because, as you would have mentioned as well, um, AIDS. Do we have HIV positive persons living in our community?
Yes, presently we have 11 persons that we know of registered in treatment and care living here in Montserrat. And again, I want to stress that these persons are living happy,
Yeah.
healthy, and productive lives. I'm not going to give any more demographics because I know there's still a lot of discrimination and stigma attached to this disease, and there really needs not to be. If you could take a look at our poster here, it says, I'll turn around if you let me, stop discrimination."
Yes.
So we really need to reach this point, but we do have 11 persons living with us on island, happy, healthy, productive lives, and they are HIV positive.
Right, but they are accessing treatment, as
They
you would have
are
mentioned.
accessing treatment and
Right.
care, and they are all virally suppressed. They're doing really exceptionally well.
That's good to hear, Penny. You would have given an example of you working in the pharmacy in the early years and having to give them so much drugs, but now it's just a one
Pill a day.
So that is definitely working based on what you're saying.
It's definitely working. The
Right.
vast majority of persons who are from modern countries in terms of modern treatments and access to care, persons with HIV in those communities will not die from AIDS. It's very unlikely they will die from natural causes, just like you and I, or old age, God willing. So that really shows how wonderful, so to speak, treatment has become, and how it helps people to live full lives. Because I can't imagine, how persons would have felt knowing that, this was like a death sentence and my life was shortened, but now that is not the case.
Right, and I must say I'm also pleased to hear that persons are accessing treatment here,
Yes, they
because
are.
we know that there's always this talk about confidentiality and so forth in the health sector, but clearly persons are accessing treatment, and we're not hearing anything. Well, I certainly do not hear certain things about that, so just
And
happy.
there are also ways around that. For persons who are really, really concerned about confidentiality, what the doctors tend to do is that they code everything, the blood samples, their prescriptions. So persons in the medical field don't even know who these persons are.
Good.
All we know is that these persons exist and we give them their medications every month and they have their access to their blood tests and whatnot. And the doctors will be the ones who have that intimate relationship with them who can identify. But our doctors are all held to an oath of confidentiality. And like you said, we're living here. We have these persons among us and we don't know who they are. And I think that says something about our confidential process, that it's working as it should be.
Right. No, but we know as well, Penny, that there are some individuals who go overseas to access treatment, and that is talked about a lot. So the numbers here, you said 11. Uh, those numbers would not reflect individuals who would have tested positive in other jurisdictions.
No, it would not. No, it would not. And it's human right to access your care where you feel comfortable. So as long as those persons are accessing care, then it's fine. And I'm going to go on a limb and say that I believe that they are, because we aren't seeing a toll on our system here where persons are turning up unexpectedly with complications of HIV and AIDS. And if we had a vast majority of people here who are getting treatment, who are testing positive elsewhere but not accessing treatment, you would see that, and we aren't seeing that. So I'm satisfied to say access your care, do your testing wherever you feel comfortable, and access care where you feel comfortable. That's the important thing. Access care.
Good message. I know you can't give out too much detail, but from the data, are you noticing any trends that you wish to highlight as it relates to HIV?
Trends that I wish to highlight. Let me think what they are presently. We do have some years we go without any new diagnosis. However, we have had a few new diagnoses in the last few years, and we really don't want to increase that number. So it hasn't reached dire proportions per se. It's just one or two people, but we want to reach that point where every year our data says no new diagnosis. And if we can do it for 3 years in a row, I think we could keep it going. So that's what I'm hoping to see coming up.
So from the 11, are there any new cases in that 11 for 2019 or even 2018?
Well, I can account for 2018, and yes, there are 2 new cases for 2018. We haven't collated 2019's data as yet from medical records.
Right. And we know that HIV is not the only sexually transmitted disease or infection on Montserrat. Can you highlight some of the other STIs that we observe here?
Yes. Okay, so we've had gonorrhea, syphilis. These are the ones that the lab here at the Glendon Hospital routinely tests for. Hepatitis. We also have the HTLV virus. This is one that's not so common. It's
explain.
the human T-cell lymphocytic, I hope I said that right, virus. And it's common in some Caribbean islands and across the world. So we routinely test for it here because we are a very fluid community. We have people from elsewhere. I myself, I'm an immigrant to Montserrat. So it's important to test for things even that aren't endemic to Montserrat. So those are the ones that are routinely tested for here. And gonorrhea, I mentioned, that is a big one that we have to continue to push testing for, because I don't know if you would be aware of this thing called super gonorrhea. It's out there in the world. That's a gonorrhea that's not treatable by any antibiotics. So we have to keep routinely testing for that because we want to make sure that that does not reach our shores.
Right.
So we
super
do
gonorrhea currently not on Montserrat. We've never seen any cases
Yeah.
here. And we want to
that we
keep it
do
that way.
have gonorrhea
Yeah.
that routinely comes around every now and again. There are also some other tests that are done by Diagnostics, that's a private lab, and that would be things like chlamydia, for example. That's another very common STI. That's actually the most common STI.
In Montserrat or
Globally,
globally? Okay.
globally, it's the most common STI, and that's tested for at DR Diagnostic. And I really want to push for persons to get tested for chlamydia because it's one of those things, gonorrhea as well. Where 80% of the persons who are infected don't know because they have no signs and symptoms. So imagine 10 people are infected and only 2 out of the 10 show any signs and symptoms. That means that the other 8 can routinely go on and spread the disease and thinking everything is okay because they haven't been tested, they don't know that they have it. So you can access other testing there at DR Diagnostics along with the Glendon Hospital lab.
Yeah. Testing is so important, as you would have mentioned here. Are you aware of any peak periods where certain STIs tend to spike a bit? And if so, tell us about those peak periods and what the
Yes.
ministry will be doing to raise greater awareness during those times.
Well, it's a good thing that you mentioned that because we're actually heading into peak season now. We've got festival coming up, and we know what happens when alcohol gets in the mix of things with decision making and whatnot. So you find around very prominent festivals like St. Patrick and our December festival, that a few weeks later you start to see a couple more cases than normal of syphilis and gonorrhea. So we do have to pay extra attention at this point in time. And what we try to do is we try to make sure that revelers who are going to be partying and on the road jumping up in jump ups and whatnot, that they have condoms. So we deliver little packages to persons who are organizing the events, for them to put in their packages. Routinely, I've worked with Island Diva, for example, Hypnotic when they have their big parties and whatnot. So all their revelers can get. We also make sure that the bars around the locales where the festivals tend to take place are overstocked with condoms at that point in time, because we want persons to and I always tell persons to leave the condoms in a place where your patrons can see them, because we want persons, yes, you're drinking, but the condom is there in sight, so you can just grab one if you need one. So that's what we're really trying to do, to ensure that everyone has access to condoms, but we can give out, we can't make people use them. So I really want to implore people to be prepared. You're going to go out, it's going to be partying and drinking. Walk with your condoms, have your condoms in your pocket. If you have them, you're way more likely to use them than if it's in the heat of the moment, it's in the dead of the night, you don't know what to do. You know what I mean? So please, and I'm going to give a little push for our casualty department here. One of the things that they do is that they give out condoms at any hour of the night. You need a condom, all the shops are closed. You can literally knock on our casualty department's door and they will give you condoms. And again, we make sure that they're overstocked around festival time and St. Patrick's time. So be aware of those times. Know that this is the time where diseases tend to increase, STIs tend to increase, and be responsible, drink responsibly, walk with your condoms, keep them with you at if you definitely need one and you can't get one anywhere, casualty department, that's the place to go.
Good message. And I actually like the fact that you're stressing condoms as opposed to condom. So you're encouraging plural, walk with condoms. And that is
Yes.
important because, there are times when, they might go out and perhaps use a condom, and that's the only one they have. And then the next time they go out, they don't have any more. And
Yes.
they take a chance, so to speak.
Even in terms of being your brother's keeper and your
Yes.
sister's keeper,
Yes.
if
lend
you have
somebody a
more than one, you're able to say, okay, friend, it looks like something's happening for you tonight. You have
So
a condom,
important.
I have in my pocket if you need. You know what I mean? So it's important to do that. And it goes back to the theme about communities making a difference. So even within our small, intimate friendships,
Yes.
we're able to make a difference. And who knows what we're doing? We could be saving somebody literally from a disease.
So
So
true.
it's
So
a good
true.
thing. We have to have that kind of relationship.
We do. And I have to ask, is the ministry overall pleased that the awareness messages are reaching the target audiences and are really having the impact that they were meant to have?
This is somewhat of a difficult question for me, and I'll tell you why. There's one very big at risk. When you talk about messaging, you want your messages to reach the most at risk groups. But some of the most at risk groups are very quiet in Montserrat, and I'll be absolutely honest and say that I don't necessarily have an in with those groups because I don't know who those people are. And for example, when you think back to the start of of the whole AIDS epidemic, you would think about men who have sex with men, the homosexual community, and that's a still a very, very, very at risk community
Yeah.
here, and at risk community anywhere.
Yes.
But it's a very quiet community here in Montserrat. It's not easy for me to identify
Yes,
who
yes.
those persons are. So I do hope that our messages are reaching them. Another
Important.
community, and I really hope that we don't have those people here. Another at-risk community are IV drug users.
Ah, yes,
And
yes.
I don't even know if we have IV drug users here on Montserrat. But when it comes to the youth, we're definitely pushing a lot our messaging to the youth, and I believe that they're reaching them because I'm in the schools, I'm in the youth groups and whatnot. I've also done work with our non-English speaking community, to make sure that because they're coming from different backgrounds with different understandings of disease. I'll tell you in the Dominican Republic, for example, sexual health is not taught at all in schools. It's not permitted, So when they come here, yes, they have some base knowledge, but it's our responsibility to educate. So I've
Yes,
done work in
yes.
those communities again, which would be at risk because of a language and a cultural barrier. Other communities that we identify, which I hope my messaging is reaching, is the elderly community, because when we're talking about sex and sexuality and disease, we always leave them out. And it's a cultural thing, we respect our elders, so maybe it's something that we don't speak about. But what trends are showing, and it's interesting, our viewers can go and look it up, that the elderly is now becoming a very at-risk group for
Yes.
sexually transmitted infections. And one of the things that are to blame, so to speak, is the Viagra, which allows men to be virile for a longer period of time. You're finding that the elderly are now engaging in more risky sexual behaviors. So we have to get our messaging out to them. So that is one of the things that is going to be on my agenda. And I started it throughout 2018, where I was trying to encourage the youth. Y'all have the messaging, speak to an elderly person about it, spread it. But we haven't done any studies per se and little research to see if that is working. So you can look out for a more targeted messaging for that population for sure.
Okay, we'll definitely be on the lookout for that. Now, Penny, one of the achievements for Montserrat, I'm not sure if you mentioned it earlier, is the elimination of mother
Mother
to
to child
child
transmission,
transmission.
yeah.
What do you think would have contributed to this for us in terms of, Montserrat being able to be successful in this regard?
Well, that is owing to a very, 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 what's the word? A strong antenatal care system.
Good.
We have that here in Montserrat, where every single pregnant woman, again, this is regardless of your status here, whether you're born here or not, whether you live here legally, illegally, whatever the case may be, it does not matter. As long as you become pregnant on island, you're entitled to care. And one of the aspects of care is HIV testing, and it was also syphilis included,
Yes,
right?
yeah.
So you're tested, and if once you're tested, you can be treated.
Yeah.
Syphilis is completely curable. You receive your treatment. If you have HIV, you receive your treatment, so you cannot spread it to your baby. So that tight, strong system is what we can owe to that, and you really have to give credit to Nurse Violet Brown and her team, who are in charge of antenatal care, because they do a really, really good job there. And even in terms of record keeping, because you've got to keep the records to say, okay, if we do have a person that's positive, have they been treated? What was the outcome? Follow up. It's very important, and they've done a really, really good job. And we've been evaluated and passed with flying colors twice now, and we're going to repeat that in another 2 years. And I'm certain that we're going to get the same result, that we will pass our evaluation, and we're going to get that gold standard again.
Absolutely. Penny, your final comments at this time.
My final comments, I just want to say a happy World AIDS Day to everyone. Use your day wisely to commemorate HIV and AIDS, like you mentioned, Fiona. Even if you aren't personally affected, you might have been impacted in some way.
Yeah.
Share your stories with one another. Share about the friend that you lost, the family member that you lost, because it keeps people remembering that even though treatment has advanced, this is still something that could claim your life, you know?
Yeah.
So keep the conversations going. You and I, we're doing our part and we're wearing our red
We
today.
are.
Yeah, so wear your red in support of the color and don't lose the
Yes.
message. Choose safe sex every single time. Choose it every single time because one slip up, one time, and you could end up being positive, you know? So my message to everybody is enjoy the day, use the day wisely to share and to spread awareness, and remember, use a condom every time because the condom is king when it comes to stopping the spread of HIV and AIDS.
And on that note, Penny, there's nothing else for me to add because you left a very strong message there. Listeners, viewers, I was speaking with Penny Maloney, Health Promotions Coordinator in the Ministry of Health for World AIDS Day, and I am your presenter, Fiona Alexander Smith, wishing you a happy World AIDS Day, and of course, hoping that the message would have resonated with you and you'll, act on the information given here. Have a good day.